Hello and welcome to NMDF121 Foundations of Nutrition. My name is Janine Castle. I'll be doing session 13. I know we've had a little bit of a break and you've had Vicky do your slides, but now I'm back. Water-soluble vitamins part 3. I love this topic. I love doing B vitamins. Okay, so you've just done vitamin B1, vitamin B2, super duper important. Today we're doing B3, B5 and B7, so 3 of the vitamin B family. So by the end of today, we're going to know about structure, absorption, function, therapeutic doses, RDIs, signs and symptoms, and a list of sources for B3, B5 and B7, and be aware that B7 is biotin. We usually say biotin, not B7. So don't forget to do your pre-class activity for 30 minutes and then I'll be doing the 2-hour lecture today and then you'll do your 30-minute post-class activity. Now, if you're there in person, it's time to discuss the outcomes and findings of your pre-class activity in person. But let's get started on the 2-hour component. Vitamin B3, similar to all the B vitamins, lots of proteins have various Bs in them, particularly B3. So you can see here that all the proteins are here, particularly liver, and then we have a few fruits and vegetables as well. There's different terminology for B3. We might say B3, but it's interchangeable with niacin, and this makes it super confusing when we talk about the B family. Niacin's the generic term for 3 other terms, okay, and they're all slightly different chemistry. Nicotinic acid, nicotinamide or niacinamide. So when you are working in a health food store and you're looking down the label of your B complex, it may show up as any of those terms. Both forms can be absorbed in the stomach. So either nicotinic and nicotinamide or niacinamide can be absorbed in the stomach, but like all the Bs and pretty much like everything gets absorbed in the small intestine. Small intestine is a big junction of high activity in the digestive system, really. Everything happens there. Everything's broken down into little bitty pieces and it enters in that area. All the other locations do a lot of work for other reasons. Small intestine, usually site of absorption. And niacin can be eaten or it can come indirectly from tryptophan. So a few sessions ago we talked about how proteins are broken down into amino acids and some amino acids are created as tryptophan. Tryptophan is an essential amino acid. Now we know that tryptophan can make niacin. It's not all of the niacin that we have in our body, but it can make some. So for 60 grams of tryptophan we get 1 milligram of niacin. Now, all the Bs are very fragile, and this is so important to understand. They're very fragile. They don't like light, heat, they don't like storage, they don't like to be aged. They're very delicate. However, B3 is resistant to heat, which is a little bit unusual, but it is very soluble, so it can be leached out in food. Food sources here. Now, Vegemite lovers will rejoice here because niacin's really high in Vegemite. That is true, but no one in their right mind would take 100 grams of Vegemite on their toast. You may do 3, 4, 5 grams perhaps, so you have to really adjust that accordingly. But for something that's very light and concentrated, it has a relatively high amount of niacin. And then we go down peanuts. We've got, gosh, wattle seed. Who would have thought? We've got seaweed. We've got chia. Right down the bottom, we've got beans. So you're more likely to be eating 100 grams of chicken breast or smoked salmon or pork. Far less likely to have 100 grams of seaweed. So you've got to factor all this in when you look at these charts. Now, recommended daily intake, obviously anyone that's growing needs plenty of Bs. So we've got infants, teenagers, pregnant women, lactating women. Goes right up to, on average, I'd say about 15 milligrams a day, which is not what I personally take every day, because the recommended daily intake in an EAR is quite low. It's very rudimentary. On average, I think a golden rule would be to get it to be around 50 milligrams of all of the Bs. Okay, but here we go in this slide when we're talking about therapeutic doses, either upper limit 35 milligrams a day is nicotinic acid, which is more concentrated, or up to 900 for nicotinamide. So you've really got to look at what type of niacin that you're using. Suggested therapeutic doses, and this is when we're trying to achieve a different effect. We're trying to actually do something. We're just not rectifying an imbalance or a deficiency. We're trying to change something profoundly. We've got to get it right up to, say, 500 milligrams for nicotinamide. Now, there's a state called pellagra, and we'll talk about this in a minute. Now, pellagra is a summary of symptoms, or a collection of symptoms from long-term B3 deficiency. So in states of pellagra, which is sort of like the most extreme B3 deficiency state and the most alarming B3 deficiency state, requires right up to 1,000 milligrams a day. Now, because it's such a dire state to be in, you do need really high doses, but you do find that Bs can rectify an issue quite quickly, so it can resolve within a week. Can use it for cholesterol management and can use up to 6 grams per day in divided doses. That's amazing. You really want to know, you really got to know what you're doing when you're dealing with that. I would think that the amount of B3 you'd have to take in capsule form would be so many capsules. You've got to be really careful that it doesn't make the person sick just on the volume of capsules that would be. But there'd be very select cases where you might consider it. Now, forms of B3, there's all different types. If you look at B3 from food, the food sources are nicotinamide adenine dinucleotide, NAD, and then you add a phosphate to it and it's NADP. Okay, so you've probably seen the terms NAD, NADP in your other biochemistry lectures, and you've never known that the N stands for nicotinamide, which is a form of vitamin B3. So you can see already that vitamin B3 is going to be involved in the energy cycles. In terms of supplements, so we've got food intake, then we've got supplement intake. With your supplements, you're going to see niacin on the side of the label and niacinamide. Then you might see niacinamide ascorbate. So please check the forms before you gauge how much you're going to give your client. 100 milligrams of niacin is the maximum allowed in supplements per capsule, that is, in Australia. That doesn't mean we are limited to 100 milligrams. That's just per capsule. Now, I have never seen a B complex with any more than 100 grams of niacin or any other of the general Bs. B12 is a different issue. There's no restriction on niacinamide, so we don't have records of dangerous levels. Now, just visually, if you look at this slide on the right, which is really quite small, you'll see here that the food forms of NAD and NADP are broken down into the small intestines to free nicotinamide. So we eat NAD, NADP, and it releases B3. Now, all of these different things happen along the way. So I don't want to go into this chart in detail, but you can see here that all of this activation of B3 occurs in the liver and a few other areas, heart, kidneys, and muscle. But if you don't consume any B3, all of that stored B3, mostly in your liver, is going to disappear after 2 months. So in times of dietary restrictions, starvations, drought, etc., if you're not having any Bs, and particularly B3 I'm talking about, you're going to run out fairly quickly. 2 months is not a long time. So you can become very deficient very quickly, which is why you see so many B3 deficiency symptoms in developing countries. So B3. B3 is a coenzyme in over 200 enzymes. That is a colossal amount of enzymes. Zinc's involved in a lot of enzymes. Iron's involved in a lot of enzymes. So too B3 is as well. Now, like all of the Bs, they're all involved in energy production and metabolism. Okay, so it's involved in the metabolism of its brother sister vitamin B6 and B9, which is folate, and the oxidation of ethanol. It's involved in energy production. So it's involved in that Krebs cycle that goes round and round, that utilizes glucose, turns it into pyruvate, and then we result in coenzyme A and blah, blah, blah. So let's just summarize that as ATP production or energy production. It's involved in cell replication, so it's involved in repair and DNA. It's involved in our antioxidant process, our anti-inflammatory process, supports vitamin D, glutathione, and thioredoxin regeneration. Okay, really important in almost everything that goes on inside of the cell. So if we take one of those functions, let's look at energy. Really important for chronic fatigue syndrome patients. Anyone that's tired, I always put on a B vitamin. Now, it's quite hard to work out why people are tired because there's 100 reasons why they would be tired. But if I can't work out the causation, I'll just put them on a B and hope for the best. And you know what? It is amazing what Bs do. So usually I wouldn't use B3 on its own. I'd use it as a complex. But this is why B complexes are so amazing for energy. B complexes go into the mitochondria, and we have a lot of mitochondria in our muscles. And our muscles need a lot of energy and they consume a lot of energy. So vitamin B3 is used for energy production within the muscle itself. It improves the creatine levels, producing higher amounts of phosphates available, and it recycles ATP. So ATP is our energy currency inside of our mitochondria. So it helps to release energy, release available energy, and then recycle ATP to be utilized again. Next function, totally different function, production of fatty acids, sterols, and DNA. If you have non-alcoholic fatty liver disease, NAFLD, B3 inhibits the breakdown of fats to release fatty acids. So there's a potential limiting capacity for storage in the liver. So we can't, once B3 is in the liver, it's quite hard for it to get out. That's what it's saying. And this can be a little bit of a problem. It's also used with cholesterol management because it can increase high density lipoproteins. So that's a good one, and you can use them with statins, which are anti-cholesterol medication. That's great. Next function, antioxidant maintenance. And this also includes B6 and B9 metabolism and as an anti-inflammatory mediator. So when would you use it in this way? For Parkinson's disease. Parkinson's should have a capital P there. So they've done studies on Parkinson's disease and found that it regenerates glutathione. We love glutathione. Glutathione is our best antioxidant in the body to reduce the inflammatory effects of free radicals. Now, if it's going to be good for Parkinson's because it does this, it's going to be good for a lot of neurodegenerative problems or just degenerative problems that are inflammatory in general. It's also used in cardiovascular health. Deficiencies of B6, B9 and B12 are associated with elevated homocysteine. Homocysteine is a molecule which is a byproduct, metabolic byproduct, and when we have too much of it, it can increase our cardiovascular symptoms like high blood pressure, increases the risks of coronary events or heart attacks. So we don't like homocysteine, we want it under control. So when you get low B6, B9 and B12, you tend to get high homocysteine, so come in with the vitamin B3. Factors increasing demand. Okay, so if you are living on a corn-rich diet or a diet high in refined grain or white rice, and that's a lot of the indigenous populations of the world, actually not so much indigenous, a lot of the populations in developing countries. So we've got South America and Central America relying very heavily on corn traditionally. Now, corn is not a terribly nutritious food, but corn is very resilient. You can store corn. It grows really well in difficult conditions. So in times of famine and drought and war, corn is a reliable carbohydrate, as in there's always corn. I know the Aztecs mostly ate corns and bean when there was no game to be hunted. So corn, different cultures have corn as a default food. Likewise, white rice is, white is a problem. Brown rice would be better, but white rice is culturally the most acceptable type of rice in very poor Asian countries and maybe the Middle East and North Africa. Problem with corn and refined rice is it has very poor nutrition. So usually you would find the B3 and all the Bs in the husk of the rice, which is taken off when it becomes white rice. So when they make it white, they lose the brown bit, and the brown bit is where all the nutrition is, including B3. If you don't have enough B2 or B6 or iron, it puts pressure on B3. Always a golden rule: have all the Bs so that one doesn't imbalance the other. If you have too much of one, you tend to need increases of the other. If you use a lot of alcohol, coffee, soft drink, tea or chocolate, you're going to need more B3. If you take a lot of medication, alcohol or drugs, you need lots of B3. This goes for most of the Bs, by the way. It's not just B3. Now, heart-nut disease is a malabsorption condition that affects tryptophan. I have never heard of that term, heart-nut disease, but I know that there are a lot of malabsorption states where you do not absorb tryptophan. And because tryptophan is the original amino acid that creates 5-HTP and then serotonin, I do know that whenever you have malabsorption states, you stop producing serotonin in the gut. So it doesn't have to be heart-nut disease for this to happen. Then we have disorders of the gut. Now this is really our area. Almost every client has some sort of malabsorption syndrome, whether that's due to aging, surgery, antibiotics, stress, alcohol use, drug abuse. Many people have inflammatory bowel disease. You're just not going to absorb your Bs. You're just not going to absorb vitamin B3. We might just have a break there.